Hey everyone, it's Steele Walker here, and I am the creator of Correcticise for Life, as well as fixyouonline.com. And today I am going to talk about me, which I think over the last couple of trainings, this is training 11, you have got a sense of about who I am. But here's some things that might not be common knowledge, and a little bit behind the scenes about who I am, where I've been, how I got here, and why I do what I do. So hopefully I won't bore you. I am now in the 5th decade of my life, so I tried to keep it brief. But anyway, I feel free to ask any questions in the chat box. We're going live on YouTube, and welcome to Sunday morning. All right, so with that, I will go ahead and share my screen. I did a presentation on myself. It's the first time I've ever done that. So again, logistically, I am, my training is physical therapy, exercise science, fitness, and cardiac rehab. I have degrees in all of those things, and website is fixyouonline.com. We are live on YouTube on Fix You Online TV, and the Facebook group is called Fix You Online. So again, without further ado, here's me. So 5 things that you may not know about me. And the first one, I get this a lot. What does DL stand for? So my given name is Deborah, and I really dislike being called Debbie. And there are people in my life that still do that, but they've been doing that for over 40 years, and I kind of give them a pass, but I really don't like that. Number 2, I wanted to become a physical therapist. I knew this at age 16 when I went and observed my volleyball coach, who was a physical therapist at Rusk Institute in New York City. And I just love the fact that she was able to give people their lives back. And I just think that is one of the most powerful things that anyone can do for another human being. So I knew I wanted to do that. However, I did not realize that goal until age 27. So there were 11 years of hard work, tenacity, other degrees, other avenues that I went down, and I finally achieved becoming a physical therapist at the age of 27. And shortly thereafter, I was kind of like, once I became a physical therapist, I'm like, well, what's next? I had this goal for 11 years. It took me that long to develop. And so I went ahead and realized I thought about my next goal. And that was when the internet was booming. Actually, it was the first internet boom back in 1997-ish. And so in 1998, I realized that I wanted to develop online programs that empowered patients or people to heal themselves. So put the power of healing back into your hands. And I realized this goal in 2015 when I developed my first program called the Bunion Solution. And we're now working on Bunion Solution 4.0. So there have been a lot of modifications, a lot of perfecting programs, and also improvements in technology so that I'm able to, just the camera quality from 2015. It's like watching, an old TV show that wasn't filmed in high definition, right? Number 4, I despise not feeling 100% in my body. And when I don't, I throw the kitchen sink at it. So if I become injured, if I become not feeling well, I have my go-to people that, are not always the same person. So I have a person for, a trauma, right? Or I have modalities for that. I have remedies for that. I have my own treatment for that. And some of these treatments I share with you on Fix You Online, some of the things, and Correcticise, the things that I do for myself when I go ahead and sustain a trauma. And, or if I'm not feeling well, I have the people that I go to for that, and the remedies that I take for that, and the people that I call on for that, and the techniques that I do for that. And that's all about what I want to share with you on these online programs. I want to give you the power that I have, because I am extremely confident when there's something wrong in my body, I have more confidence than I do probably with anything else in my personal world with illness. And it's actually something that most people don't have. I think it's a really great skill that I have, like I said, almost 100% confidence in my own decision making, and have been able to guide myself and guide my family members in a path that has worked really, really, really well for them and for me. And again, that's kind of what I want to share with you guys. And number 5, I experienced, I call it in quote, alternative medicine. It was actually chiropractic at the age of 14. And I've continued to use alternative medicines, modalities as part of my healthcare ever since. It doesn't mean I don't go to a medical doctor. I absolutely do. However, I also consult with other people when there's something going on in my life personally with regard to my health. So, I did a lot of things when I was pregnant in preparation for birth. And then also when I was given a diagnosis of Lyme's disease, I went ahead and consulted a bunch of different practitioners and really have a handle on that. I don't have any sort of typical Lyme's disease symptoms at all. And I am eternally grateful, because there are, that could be devastating and is devastating for a number of people. All right. So how did I get here? I always kind of had a commitment of question to question about things. And then obviously commitment to learn about new avenues, new ways to do things, new ways to help people. I used to say if I could stand on my head and spit nickels and it would help somebody, I would do it. So, understanding the different types of methods to go ahead and improve the quality of life of another individual. That's what my ultimate goal was as a physical therapist, for sure. And with these programs. Then a commitment to figure out how the body works. So I've kind of always wanted to understand, well, why does somebody develop arthritis? Why doesn't everybody develop arthritis in a certain joint? Everybody's got the same joint. Everybody's got the same, at the same skeleton, right? The same DNA. What's different, right? Why? And I've just always questioned that. As I have gotten a great philosophy as a result of all of those questions and looking at patients and experiencing what I've experienced in my practice. And then a commitment to look at the why behind the what. And that goes back to figuring out how the body works. Why this? I had a patient once talk about something called idiopathic. So idiopathic means that there's no rhyme or reason for it. And he said, not me, that idiopathic means that your doctor's an idiot and you're pathetic. I did not say that. This is coming from a client. But my feeling is that there's got to be a reason. Otherwise, it would happen to everybody. So there has to be a reason. It's your job to figure out what that reason is, because the reason for one person might not be the reason for everybody, certainly, or certainly not your case. And I guess the other thing that I would say to people is that the answer is out there. It's up to you to find it. So there are many modalities or many different ways to address a particular problem. And why not try them all, certainly before you undergo a modality that may be life-threatening or life-altering. And then lastly, I now have the opportunity to share, because I'm available on YouTube and websites, and I can provide all this information to people. So here's some of my philosophies regarding health and healing. So as you've probably heard over and over again, alignment dictates function, frequency, and flow. So I can't say that enough. It's always my goal when I am working with somebody, first, if they are in pain, get them out of pain, and then restore alignment. Usually by restoring alignment, it will get them out of pain. So they kind of go hand in hand. The second one is that you can't put a price tag on your health. You really can't. It is probably, I think, our most valuable possession. That is probably most overlooked in the majority of people until it's lost. And when it's lost, sometimes it can't come back. So my job is to, when it can, or in spite of some diagnoses that you've been given, or situations that are in your life, to optimize what you have and take it to the highest level. Go to the nearest drugstore, but go to the best doctor or practitioner. And a lot of times my patients would choose a doctor that was close to them in their neighborhood. My feeling on that is that you need to make it a priority to travel, if need be, to the person that is going to get you well, or somehow get in touch with them. Nowadays we have telemedicine, which is a great modality, which wasn't the case when I was back in practice about 10 years ago. And then lastly, don't get sick. Try not to get sick. Do everything you can not to get sick. Because when you do, you, especially nowadays, become very vulnerable, particularly in the hospital settings. If you can't have an advocate with you in the hospital, which you cannot, I believe nowadays because of the virus, that to me is downright frightening. That to me, knowing about medical errors, knowing about patient advocacy, understanding about the procedures that wind up getting done to you that you might not have, or medications that might be given to you that you don't want or need. When I had given birth, after I gave birth to my daughter, the nurse comes in with some pills. What are these? Well, this is a pain pill, which, by the way, I get sick when I take pain pills. And then this is a stool softener. So I don't want them. I'm not in that much pain. I'd be happy to take a Tylenol, but I don't want a pain pill. I don't need it. And the other thing was a stool softener. I said, you know what? To me, a stool softener is good diet, lots of water, and exercise. And sure enough, didn't take the stool softener. And it won't get personal, but I did not need the stool softener at all. I did exactly what I needed to do, what I said I would do, and I was just fine, if not better. So, I personally don't want to put myself in that vulnerable position of, being very, sick to the point that maybe I can't advocate for myself in a setting where I don't have advocates for me. That to me is daunting and sadly a reality right now. And God forbid it was my child, because I think I would go, I would be probably the nurse's least favorite person. But gosh, I can't even imagine. I can't. So that's why I developed Correcticise and Fix You Online, both of them. And they are different programs that are similar in a lot of ways. So what do? They possibly prevent the need for medications and surgery. Both of them can do that. Again, depending on what your issue might be, or if you have an issue, okay? If not, then Correcticise is really like a maintenance program for your body. It's a prevention program for your life. And then the second one was Correcticise to give people an effective, efficient, and affordable exercise regime. Okay, I call it exercise. It's really activities, because within the program, which I'll preview in the next few days, I am going to be teaching you how to be your own self shaman. Okay, how to realize what your problem is, how to take care of it, and through access to me, answer any questions that you have to guide you in the right direction. So the next one is to optimize your body's function. Both of them do that, but again, Fix You Online is more specific to a particular area, body part, or a specific lifestyle task, where Correcticise is more general, and but we do a total body renovation, which should optimize your body within the program and then keep it going with just a 7 to 15-minute commitment per day, which I think is great. Because honestly, I love being active, but I don't like exercise. And there's very few exercises that I will enjoy. And I certainly dislike rehab, which is so ironic. Number 4 is to help people recover from pain, undo the wear and tear in time, and become resilient from future trauma and disease. And again, both of them will do this. Fix You Online is more specific. Correcticise is going to be a little bit more general. So again, if you have a specific problem, Fix You Online. If it's general and general wellness, prevention, optimization of a whole body system, looking at the sensory portions as well, Correcticise is the one to go with. Give people to access to experts and adjunctive solutions to their well-being and wellness. So again, both of these will have access to me, and I will be doing vidcasts or interviews with individuals who are experts in different areas of wellness and health and medicine and well-being and science, et cetera, who can answer some questions for you directly about your particular problem when they are interviewed or when the recording comes up. Number 6, to keep people from becoming a medical error or statistic, right? So medical errors occur in medicine. So again, I want to prevent people, any one of you from being the 250,000 people that die every year from medical errors. To keep seniors independent in their homes. So I worked with seniors for 10 years, and that is the goal of the majority of them. And the ones who took the time and were committed, like I said, lived into their 90s with minimal assistance at home. So, grow older on your terms, because this is a quote from a patient of mine: getting older is not for sissies, but it doesn't have to be. Because if you can make these changes in your 40s and 50s, not that you can't make changes as you get older, it's just easier to address when you are younger. The younger the intervention, the easier it is. The younger the clients, the easier it is. Number 9, there's no other online programs out there specifically designed to restore optimal functioning that I am aware of, that are comprehensive and specific to things like sensory fitness, to things, again, there's flexibility programs, but really, are they safe and sound flexibility programs? Is yoga, a safe and sound flexibility program? If it's done properly, I like yoga. I was really into hot yoga before COVID. I very much enjoyed it. But I was very, very, I'm very in tune with my body. I know what to do and how to move, so I could make it safe and appropriate and even more effective than probably an individual who does not have that knowledge and awareness. And that's my job, is to teach you guys that information. Okay. There's no other programs designed to teach you the proper and optimal way to do the activities that are necessary in your daily life without causing damage. So remember, sitting, micro traumas, walking on a flat tire or a tire without air, it's causing damage, much less running, or again, doing a sport. Even the best trained athletes, right? Look at Pete Sampras, Andre Agassi, will, ultimately sustain injury because their bodies are not in proper alignment, working order, and probably mobility, which is then winds up over time causing you to compensate in the way that you do things, and you become injured when you run out of compensations. And lastly is to honor the people whose lives were cut short and it didn't need to have to be that way. So I've lost patients to medical errors. I've lost people to medical errors, and I want to honor them. I want to, let them know that that I developed these programs and kept them in mind. All right. So what is Correcticise? It's the must-have membership for your 40s, 50s, and beyond. So most of the functions, like the sensory functions, the muscular fitness functions, cardiovascular functions, all deteriorate at about age 40. That is the research. That is the research. Again, my question is it age? Is it actual age, or is it disuse? Because I am now 50 and I am in some ways better able to do the things that I did when I was younger. In some ways, I'm better able to do activities that were, than I was a year ago. And I, really am, I feel blessed, but I know it's because of the hard work, or not the hard work, but the work that I've done on myself, that I'm able to do all of the sports and activities that I love without being injured, both traumatically and also over time. So I want to keep it that way. So that's what I'm sharing with you guys. Also, to get out of pain naturally without medications or surgery. Like I said, my assistant was looking up a symptom on, quote unquote, Dr. Google. And the only thing that was self-empowering or self-help was to take an anti-inflammatory. But no, on Fix You Online TV, I have several different techniques to go ahead and realign your lower back, your sacroiliac joint. I have ways to go ahead and treat that stitch in your shoulder. I'm giving you these techniques so that you can get out of pain naturally, so they don't develop into something that forces you to go to to go into the system, and you're wasting time when it could be something that is addressed very, very, very quickly on your own and resolved. So I'll give you another personal example. One day I developed tingling in my finger. And, of course, when you know what you know, thinking, oh my God, I have MS or, some other neurological problem. And sure enough, I'm a manual therapist. I work with my hands. And I went ahead and went into my forearm, right? And felt a restricted connective tissue that when I pressed on it was exquisitely tender and painful. But I went ahead and treated it using the comprehensive cord release technique, which I showed you guys a couple of lessons back. And sure enough, the tingling went away. I saved my insurance company thousands on a doctor's appointment, an MRI, and then who the heck knows what they would have found that was probably not even my problem to begin with. Because, a test is a picture, right? Like an X-ray. Is a picture of, or an MRI, picture of a situation that's going on at this particular moment in time. And it does not necessarily mean that you are going to have pain, that you need surgery, or that you need any other intervention. The only reason, as I said earlier, to have a surgical procedure is when it impedes upon your quality of life. That's it. Unless it is life-threatening, of course. Don't get me wrong about that. If it's life-threatening, obviously it needs to get done. But if it's not life-threatening, then it doesn't need to happen unless there is a decrease, a significant decrease in your quality of life that's not manageable. So I wanted also to have people manage their bodies correctly to be resilient to injury, disease now and in the future. So again, it doesn't mean that you're not going to experience trauma or disease. It means that you have the resilience to recover more quickly and not have that trauma or disease manifest into something that is life-threatening or severe. Okay, that is less so. And then learn the proper and most effective way to move and to exercise without spending countless hours in the gym, and make life your exercise. Just because people exercise does not mean that they have fitness. I went through the four different aspects of fitness. Just because somebody can walk 7 miles does not mean that they have great flexibility. It does not mean that they have good force absorption through their joints. It does not mean that they have good sensory fitness, right? But all of these things are really important to activities, okay, to the things that we do in our daily life, to our exercise program, and especially if you want to continue in sport, hands down. Access to experts without having to travel to an appointment. So where else can you do that? And then optimize your time and energy by targeting the neurological, muscular, and skeletal systems that diminish after the age of 40. So again, that's just the research. I don't know if it is age or disuse. I think it's probably a combination of both. We can't change the age, we can change the disuse, and we certainly can change the structure that you are functioning on. Remember, this is the only car that you're going to get. You need to maintain it and you need to repair it, right? That's why I'm doing a body renovation. You need to, and many of us need to repair it. So with Fix You Online, Pioneers of Self-Health, this has been around now for a few years, and there are specialized programs on there, particularly for foot and ankle. And but they will probably continue throughout the body. It's my hope, body, mind, and spirit, actually. So Fix You Online is to get out of pain, avoid medication, and postpone or eliminate the need for surgery for a specific diagnosed condition. So these are prefabricated programs made by me that are video, online, step-by-step programs to resolve the pain and the inability to have good quality of life when you have certain diagnoses. Learn how to self-manage a specific body part from the comfort of your home. Again, you can do that. Improve functional tasks to retain independence at your home and your daily life. So again, there are going to be programs that are step-by-step programs that take, say, walking, broken down into its component parts, and then teach you how to resolve those parts and become more efficient in walking, better going up and down stairs. Because again, if you don't have the body to do the task safely and appropriately, you're doing yourself harm. Over time, you're doing yourself harm. I can't tell you how many patients that I worked with that were seniors that would tell me, I used to walk, and this was in New York City, I used to walk everywhere. I walked down to Times Square, I walked over to this place, I walked over to that place. Now they can't even walk in their homes. My grandfather skied at the age of 79 and could not walk at the age when he died 10 years later. And he was an avid skier for 40 some odd years. He was an active person. He went walking with my grandmother over to the local university. I mean, he had the will to do it. It's just his body couldn't do it. So why? Because he broke down over time. He broke down over time because he was functioning on a car with a flat tire or flat tires. So to wear shoes comfortably without spending thousands to do so. This is going back more to my foot and ankle programs, but you know, many people are spending a lot of money on shoes and orthotics and those kinds of things, which are great, and they are an adjunct, but they're not solving the problem. Why not get to the why behind the what? The problem is your body, okay? Because if it wasn't your body, then everyone would have bunions. Everyone would have hammer toes. Everyone would have plantar fasciitis. Everyone would have, and that's not the case. What is different? Like I said, our DNA is exactly the same. What makes the difference? It's your body. What makes the difference when you are like falling down a flight of stairs, my daughter doing so versus my grandmother? The body of, not the forces of the trauma, but the body that is sustaining it. Again, also access to experts without having to travel to an office or appointment. That expert would be me. And then also the people that I'm interviewing. And then also, if you do need to have surgery, there's something called, there's a way to prepare for it, both within your body and mentally, so that you can improve your outcomes and decrease the need for pain medications after your procedure and have a better, help to get you in the situation to have a better outcome as a result of this surgical procedure. And that is something that is coming into existence now, even in the medical field. It's something called prehab. And some really good surgeons will not do surgery on their patients until they have a certain number of weeks of prehab and physical therapy. But again, you can take prehab into your own hands and prepare for surgery on your own. And these are ways that you can do it. And that's that. So if there are any questions, I will go ahead and answer them. But I hope that you kind of are getting a sense of the programs that I'm offering, and I will go ahead and give you some previews coming up in the next few days that will show you a little bit more about the programs that are available, and those of you who are joining me will get a special offer at the end of it. So thank you so much. There were no questions, but I will go ahead and wish you all a great Sunday, and I will see you tomorrow, where I am going to be debuting the Correcticise for Life fitness program. All right, until next time, take good care of your body, mind, and spirit, because it is the only one you're going to get, and really the only true home that you really have. Ciao.